This episode of the ABIC podcast is brought to you by Marini. Hello and welcome to the ABIC podcast, your online support community for the aesthetic and beauty industry. Here, we're strengthening and unifying the industry through representation, innovation, and education. This is a platform created and dedicated to the aesthetic and beauty industry, valuing unity and advancement. We serve to represent, support, and inspire you by connecting you with industry experts, expanding your knowledge through educational pieces, and bringing you the latest industry news. This is the ABIC podcast. I'm your host, Stephanie Miller, and today's guest is Vivien Gardiner from Marini. Vivien is a highly experienced registered nurse and managing director of Erase Aesthetic Services. With a background in operating theatre management, surgical assisting, and managing a plastic surgical practice, Vivien brings extensive knowledge of both the medical and aesthetic fields. Vivien has been at the helm of Erase Aesthetic Services, one of Melbourne's most successful medical aesthetic clinics, since it was founded in 1997 as Australia's first retail clinic of its kind. In addition to leading Erase, Vivien is also the Managing Director of JMSR Australia, the distributors for Marini Skin Research for over 20 years. Her incredible experience doesn't stop there. Vivien also volunteered with Interplast Australia for 20 years, providing surgical services to remote communities in Indonesia. Vivien's unique blend of expertise in surgical nursing, aesthetic medical services, and skincare integration gives her a deep understanding of the kind of support clinics need from their suppliers. Here to discuss the difference between passive and active skincare from Marini, today we welcome Vivien Gardiner. Welcome to the podcast, Vivien. How are you?
Great. Thank you, Steph. Thank you for having me. It's lovely to join you today and be part of this amazing organisation, ABIC, which is really helping the industry level up.
Thank you. My goodness. I'm actually really excited to talk to you today because you and I have a lot in common.
We do. We do, especially a long history in the industry, correct?
Absolutely. You know what? Let's start there. Vivien,
Okay.
tell everyone that is listening right now, how did you come to be in the professional beauty and aesthetic industry?
Well, long story short, I was an operating room nurse. So that was my career. I met my husband in an operating theatre, as you do. And he is a plastic surgeon. So, of course, we were very interested in how we could separate the aesthetic side of the services that he does with the reconstructive and, much more serious things like melanoma. So we understood that you couldn't have a waiting room where half the people were there for what were considered vanity options with the same people who were struggling with a life-changing diagnosis or had a child born with a terrible malformation that needed surgical correction. So there was this dichotomy, and that's true of plastic surgery in general. There are people who use the services of a plastic surgeon for their own self-enhancement and self-worth. And then there are people who are forced to go there because life has dealt them a blow of some type. So in 1995, we started to think about, let's have a look at a shop front where we can do these sorts of services. And he could go there a couple of times a week and we could employ some people to do treatments, as in facial treatments, etc. So it was a bit of a long shot, and we found this daggy old space in Glenferrie Road, Malvern, and we had some sort of retail outlet on one side and the TAB on the other side. So our front window in those days, it was before the internet, everyone used to go into the TAB to place their bets. So, and then
Nice.
wait for the race to come on. So they'd all be leaning against our front window, smoking ciggies and reading the race form. And it was
Oh,
really
no, very
hilarious.
elegant.
Yeah, very non-aesthetic, I would say. In any case, that's how we began. We employed a dermal clinician straight up. So our first staff member, our first team member, apart from our receptionist, was a dermal clinician, and she knocked on our door and said, "Hey, you need me." She had just graduated. That's Kylie Christie, who's an absolute stalwart in the industry. She's a beautiful girl. She still works with us. So she's been with us since the beginning. And we didn't really understand what a dermal clinician did, but she pretty quickly educated us on that. And her understanding of skin and treatments was way different to ours, because we come from the surgical space. She came from the aesthetic space and skin condition management space, which was not really our thing. I think dermatologists obviously would be much better versed at that side of it, but then they approach it from a medical perspective too. So it's the dermal clinician side was much more about long-term, medium to long-term management of people's skin. So we saw that as being very valuable. So we started this clinic. We started with an IPL hair removal machine, the old, oh gosh, the
Starlux,
old,
Estilux.
and it was an original. We had a Photoderm IPL.
Photoderm, wow,
Yes, and the old Vasculite IPL machine. So it was really fascinating because it was totally trial and error for us. We had been using lasers in surgery, a carbon dioxide laser at the hospital, but it was a massive machine. It was the size of a car, and it used to get trundled around to theatre, and it lived down in the basement of the hospital. So we had some experience with lasers, and we knew about parameters and fluence and all that sort of thing. So we were quite careful in the beginning, and then we pretty quickly realized that we could tune the machines up or down really effectively. So we started doing things like blood vessels and port wine stains, hyperpigmentation, and we kind of learned as we went. And Kylie was amazing in that regard, in that she was very conservative, but also prepared to push boundaries within a margin of safety. And so we developed from there.
Real pioneers. I mean, every
Yes,
time I talk to you, I'm blown away, for starters, about the history that you've had within the industry, but your vast experience, because you run the gamut right from, surgical to non-surgical, and then you transitioned over to skincare. And we have a lot of things in common. As I'm speaking with you, I'm
yes, because
realizing,
you've been in the industry as long as I have, I think, Steph, haven't
well,
you?
just maybe not as long, but nearly. I'm nearly there.
Nearly, yes, yeah.
But the trajectory is very incredible, because you do start off in that area. Because I started off in medical aesthetics as well, and then the interest and the fascination in
Mm,
what you can achieve with ingredients alone and with skincare, you over
exactly,
the years
yeah.
become mind blown. It is just
Mm,
a revelation, really. And we were
yeah.
talking about how Jan Marini came up in this incredible journey of yours, and how it was, you called it serendipitous as well. Tell us about that story.
Well, we needed a skincare line, obviously. Part of what you do when you're managing people's skin is help them to follow a routine at home, which will improve their skin health, their skin function, and then the treatments you do are obviously going to be much more effective. If the skin health is robust, then it repairs itself in a much more fortuitous way than if you just do treatments, send them home, 6 weeks later see them again, or 2 months or 6 months, whatever the time frame is. So we also really understood that preparing the skin beforehand was important. I mean, we've been to a bunch of conferences over the years where plastic surgeons present on, all their work, their facial work, for example, their reconstructive work, and it always interested us that we would look at an amazing surgical result, but it was really obvious that the skin texture, the skin condition was terrible, looked
Yeah.
so unhealthy, so damaged. And nobody really paid any attention to us. And then there were some early studies done on what do people find more attractive. If you look at someone who's had a surgical facelift, do
Mm.
you think they're more attractive than someone who hasn't had a surgical facelift but has really maintained and looked after their skin? And a majority of people found the healthy skin photograph more appealing than the surgical facelift, even if it was a really good facelift with good results. If the skin looks crappy, it's not as appealing to the observer. And
Mm.
I think really that's a biological response in
It is.
us.
It's a projection of health, isn't it?
It is totally. So we looked for a skincare brand. We wanted to get MD formulations in because in the 90s, that was the biggest brand in the
Wasn't it?
world.
We
Yeah,
had that as
massive,
well, yes.
massive. Yeah. So, and we learned that MD formulations had just been sold to Allergan, but that the founder of MD formulations had sold and then opened her own brand or started her
Mm.
own eponymous brand, which was Jan Marini. So we started to hear about this. We used to go to all the meetings in the US and Europe in those days to keep up with techniques and what was going on, not in the aesthetic industry, but in the surgical
Mm.
space. And we were kept hearing about this incredible new brand, Jamarini. So we reached out to them and asked who the distributor was in Australia. And they said, oh, well, look, we're brand new. We only have a distributor in the UK at the moment. So would you like to distribute for us? And we had no idea how we were going to do that, but
But
we
the answer was
flew.
yes, of course
Well, it
we
wasn't
will.
really yes. We
All
met.
right.
We went to San Francisco. We met them, and we met Jan, and she is still the most amazing woman. She's so knowledgeable
Wow.
and so gracious. Such a beautiful human being. And we realized that we could easily partner. It wasn't a corporate partnership. It wasn't like a private equity type arrangement. She deliberately structured Jamarini to be different because that's what she'd come out of with MD formulations. You know,
Mm.
once a company gets shareholders in private equity, it becomes big business. The shareholders become much more important than the customers or the team. And she resolved at the beginning to make this a big business that behaves like a small business. So
Wonderful.
we saw that as being very appealing. So we took the brand on and we started by I used a couple of products to see how it would work. And I had problem skin all my life, you know, hormonal breakouts, pigmentation, just dull skin, big pores. I was never happy with it. And then when I had children, it got even worse. So I used these, you know, a cleanser, a moisturizer, and a sun protectant. And within 3 days, my skin had completely changed. And I said to my husband and to the team at the clinic, this is the product we have to try. We have to get this in and see how it goes. So we made the arrangements and started prescribing it to people. And we were blown away by the feedback. So we've gone from there and we've had, you know, 20 to 23 years we've partnered with Jamarini, and we've had that many years of constant daily feedback from people about how great their skin is once they start using it. And I think that's a really, that really made us think about what is it about two types of skincare, two different brands, and they can have exactly the same ingredients,
Yes.
but they work so differently. So we really have thought about this and discussed this a lot over the years, particularly with Jan and her team, her R&D team. It's really fascinating. There's a spectrum of scientific depth and understanding that most consumers don't really recognize. They read the marketing materials and, you know, they take it at face value as why wouldn't you? Correct?
Absolutely. And
Yeah.
consumers are getting more savvy and they don't just look at the marketing now, they look at the INCI list, they look at the ingredient list and they think,
Yes.
right, I recognize an ingredient here that could work for my skin, but they don't understand how the formulation plays a part in whether or not it's an active skincare brand, or the percentage that's used, or if it's
Yes.
used in symbiosis with others. Let's talk about skincare and skincare formulations. You have a beautiful saying, active and passive skincare. Can you explain to us in your words, what's the difference between the two?
Well, this is the way I see it. First of all, the skin is a barrier. So whatever you put in is going to be blocked by the physiology of the skin and the biochemistry of the skin. It's not going to absorb and do what it says it's supposed to do unless it's chaperoned with particular ingredients. So biochemical science is so complex. Even research institutes are only scratching the surface, and they'll freely admit that. Scientists who've worked on this stuff for 30 or 40 years will say we're it's like there's a universe within skin. It's like us knowing what's in the next solar system. We don't. And that's the same as what research scientists talk about when they look at a particular function in the skin. It becomes more and more complex. The more they look, the more they find. So I think from the point of view of skincare, the deeper your understanding of how skin physiology works and the longer your experience with formulating, the better opportunity you have of getting to the point of making something that is actually active. But the thing that overshadows all of this is regulatory control. So, in order to be classed as a cosmetic, which is what all skincare is classed as, we can't talk about biochemical properties, physiology, finding its way to particular cells, all those sorts of things would make it a therapeutic product, and therefore it would have to be registered as a medicine. And that comes with its own set of complications. The regulators are always well behind the development in any sector, right? So technological development, scientific research, etc., is always well ahead of regulators. So it's not until problems start to arise that the regulators have a look at it.
Exactly right.
So, for example, in the US in 2022, the Modernisation of Cosmetic Regulations Act was passed, and that's been implemented fully now in the US. So you can't sell a product to a US consumer unless you're registered with the FDA and you've submitted all the data on your ingredients, where they're sourced, what safety parameters you are ensuring along the way, chain of custody, all those sorts of things have to be filed with the FDA. And that's to protect consumers. Part of what they were trying to achieve was to make things more transparent for American consumers. And I think that's not a bad thing. We hate regulation in general. It's just regulation on top of regulation on top of regulation. But sometimes those sorts of things are beneficial ultimately, because it does mean that terms like clean, the consumer's going to look at that a bit differently now, because what does clean mean? I think the cleanness is in the scientific integrity and the formulation integrity and the results that you can achieve. So the regulatory burden is real, and it does define how we can speak about products and skincare in particular. But there's no doubt, if you use an effective skincare and active skincare that is well formulated, it will bring about those changes. So we'll talk further about that, I'm sure, as we go on.
I'd love to delve into the regulatory world and compare. Obviously, Australia and America are quite different in what is the kind of chain of events that you need to go through to actually be able to make your product available to the market.
Yeah.
And when you were saying about the US is very important, because when you now are bringing US products into Australia, they are all already adhering to those stringent requirements.
Yes.
Not to say that Australia doesn't have really good requirements. It's just America is now leading the way and leveling up. I think EU is doing a really good job in a lot of things as well, especially when it comes to organic claims or sourcing and things like that.
Yeah, and I think that's the difference between, active and passive. We've tried making products in Australia before, and we've tried even bringing in Marini and formulating under license here, but we don't have the laboratory infrastructure in Australia. So there are certain laboratory processes that have to go on that, it costs tens of millions of dollars to set up the kind of sophisticated laboratory that Marini uses in the US, or
Mm.
that makes the ingredients in the US. So it's not possible for us to formulate here. We did try our own before we got involved with Marini, and then we extended that for a few years afterwards. We made products that were for specific purposes. We had no long-term relationship with any suppliers in the US or the UK or Europe.
Back then, that was the point, I suppose, when you were looking at manufacturing in Australia, it does become expensive, and the expenses are prohibitive. So you're either
Yes.
partnering with a contract manufacturer, and if you don't want to have your own, and if you're building your own, it's millions. I mean, we just
Yeah.
spoke to someone who's building an ISO, I think it was ISO 7 or something like that, labs here, and they're in the hundreds of millions, I think, importing German equipment down here. So
Yes.
you can
Yes.
imagine
Yes. It's
it's
hugely
a massive
expensive.
endeavor. Yeah.
Yeah. There are still quite a few step processes in scientific cosmetic formulation that can only be done at the CSIRO. To get a private label product tested there is impossible, because the CSIRO is a government laboratory. So they don't test things for private manufacturers. They're busy doing big public health stuff. So I think the laboratory situation in Australia is improving, but contract manufacturers still don't have the kind of equipment, the sophisticated equipment that's required, for example, to formulate retinol effectively. Okay, so that's why there's no one making it here. There's so much more to it than people really understand. We would love to manufacture our own products here, but we know we're not going to get the results.
You're talking about creating an ingredient, and creating an
Yes.
ingredient is a different thing. You can still manufacture in Australia, getting an ingredient from overseas, but if you're going to create a retinol in Australia, it is very limiting. But
Yeah. Do you know of anyone, Steph, who's making retinol in
not in
Australia?
Australia, no. I'm a cosmetic
No.
formulator, so I would
Yeah,
know.
yeah.
No,
It's
no.
really hard. And the
I get
bulk
my
of the
stuff from
work.
Israel. I mean, they have
Yeah.
like,
Israel are amazing.
yeah.
They've got real tech over
Yeah,
there,
that's
and
where
they
I get my
have,
stuff from.
yeah.
But I manufacture and formulate here in Australia. And lots of people do. It's just, I even know that the formulations at the labs in America, I mean, my goodness, the actual requirements to pass a skincare product there are different to Australia. Let's talk about passive and active skincare within Jan Marini. How do you classify passive skincare?
Well, passive skincare, I classify as anything that you put on the skin that doesn't bring about a change in the skin's appearance. Okay, so, but there is another level to think about it on. Sometimes you want passive skincare. If you've just done a skin needling or a laser resurfacing or a Fraxel, for example, and you put on active skincare, it's going to be too much. You're going to get too much inflammation. We used to think inflammation was what brought about the benefit. So we would attack people with tretinoin and, hydroquinone and
I remember
flare
those
up
days.
their skin as much as we could. And then the healing process, what we used to
cascade.
call the trauma shock of the skin, the cascade would
Kick in.
create the benefit, would stimulate collagen production, etc. But it's actually not. It's my thinking has shifted 180 degrees on this. And this is from many, many years, 22 years of really looking at it, thinking about it, watching results, monitoring patients. The opposite is true. It's the downregulation of inflammation which enables skin to function.
Very good.
So anything that is causing an inflammation in your skin should only be transitory. So it might be the initial shock. Your skin's never had an acid on it before. It might be a bit tingly and get a bit pink the first day, for example. But if you rest for a couple of days and then try again, and the reaction is equal to or less, you wait a couple of days, try again. Gradually, you acclimatize your skin to that ingredient, and then it starts to go to work and have a benefit. But most skincare ought to be anti-inflammatory, because all of the things that we see, acne, hyperpigmentation, rosacea, everything that people worry about in their skin that concerns them is due to an inflammatory cascade. So if you can intervene there by understanding the way inflammatory markers work, then you can start the skin on a process of healing and good health, and then it starts to look so much better.
For over 30 years, Jan Marini Skin Research has led the way in innovative skincare solutions, setting new industry standards. Their award-winning home care and in-clinic treatments have made them a trusted partner for skin clinicians. Recently recognised by Skincare Anarchy in the top 5 categories, Jan Marini continues to deliver results that grow businesses and transform skin. Experience the difference with cutting-edge technology and proven solutions. Learn more at janmariniaustralia.com.au.
So I think that is my understanding of active skincare. It's skincare that's actually functioning within the skin. It does so not by getting into the skin, but by interacting with biomolecular markers on the surface. So even on our dead keratinocytes on the very surface of the skin, we still have receptors that signal deeper cells which are still living and are working their way to the surface. And that cascade flows all the way through to the dermis. So there is a function to skincare, and that can help repair skin, make it healthy again. And then you can start to deal with things like blood vessels, deeper pigmentation, lines and wrinkles, acne, whatever it might be, scarring. There's so many things that we as clinicians address for people every day. So the foundation is always healthy skin, because you're going to get a much better result. So that's what I would consider active skincare. Passive skincare, on the other hand, is something that you put on your skin, and skincare always has a lot of what we call film formers, so that it looks nice when you apply it and it feels nice on the surface. But if after 3 or 4 weeks you're not seeing any difference at all, even though it might contain all those amazing ingredients, if it's not making a difference, then it's not active skincare. So that's what I see as the distinction between active and passive skincare.
I love what you've just said. Everything you said about inflammation is perfect. Harvard has some time ago came out with a study saying the common causative factor in all illnesses, like congenital, if you're not born with it, you acquire it's uncontrolled inflammation, uncontrolled,
Yes.
unknown inflammation, and that goes with our health. That's our internal health, but the same can be said for our skin. Every acquired skin concern is an inflammatory problem.
It is.
And a chronic inflammatory problem. I love the way that you had a distinction, because an initial, inflammatory cascade, the initial trauma, the inflammation is necessary to heal that trauma. But if it's ongoing, uncontrolled, long term, that's when you get the problems happening, right?
And the thing is that we assault our skin every day, right? To keep that chronic inflammation cascading day after day. So we're either exposing to UV, we're putting chemicals on our skin that are not compatible with good health or skin health. We scrub our faces with sand granules in the old apricot scrub, remember, that we all used as the apricot, ground up apricot kernels, all these things.
Pollution,
pollution,
pollution.
just daily life. Yeah. I mean, we're really fortunate in Australia in that we're, low population, huge landmass. So it's entirely different, for example, to living in China or India, right? Because pollution levels there are completely out of control. But as you say, it doesn't take much. You can just sit in traffic every day. If you're sitting in traffic every day and you've got your air conditioning on, flow through, and all those aerosolized toxins coming in and sitting on your skin, you're breathing them in, they're, as you say, they're circulating around your body. All those things have an effect. So chronic inflammation, the number one cause of chronic inflammation, though, is UV exposure. There's no doubt about that. Anybody who starts to use a sun protectant product will notice within a couple of months that their skin is starting to look better. And over the course of 12 to 24 months, you're going to see vast improvement. And that's just with one single step. So imagine how much better you can do if you're helping the cells to turn over, down regulating the inflammatory signals, helping the dermis to become more robust, calming melanocytes so you're not getting as much pigmentation, killing the C. acnes bacteria. All those things, they target the signs of your skin inflammation, but the daily protection or the daily feeding of your skin with good nutrients, it's just like diet and exercise, right? It's the same thing. It's got to be a long-term commitment. There's no point in doing it once or twice. And that's why therapists understand the importance of daily home care. So whatever they're doing in clinic is like the accelerator for what they're doing at home. So our philosophy is start on the skincare regime at least 2 weeks prior to your treatment, because we're going to have such a better canvas to work with, regardless of what we're trying to achieve. And in that sense, it's also that the skin is functioning really healthily. It's like if you were going to have cardiac surgery, for example, but your blood pressure was way high. So the first thing that the specialists would do is get your blood pressure under control before they do the surgery. So it's the same thing with skin treatments. If you go hard on someone with needling or a Fraxel or whatever, they're not only not going to heal as well, the inflammation that's triggered in their skin is going to sometimes, quite often, be a long-term issue for them.
You know, the problem, Vivien, is that we did the research, and we even speak to some of our software. I mean, we've got Forest as I use Forest anyway in my clinics, but there's heaps of great software companies out there, and some of them are partners with AVIC, and we have just in general conversation and talking to various ones, you find out that actually the average amount of sales, and I'm just talking sales because that's a way to get product into clients' hands, but the average amount of sales, or how a therapist gets product into a client's hands, they usually walk away with less than one product per person on average.
Yes.
And that's a real problem, because we're talking about right now, what you do at home is basically a large part of the treatment process, but yet our patients, our clients are walking away with not a huge amount of products. They might walk away with a cleanser, or they might walk away with a sunscreen, which is even better. But the importance of getting various products into these clients' hands, we can't underestimate that. What's
No.
the best way to be able to present skincare to clients or patients so that they actually understand the benefit of it? Because we've only got a small amount of time, right, with a patient today.
Yes, that's right. So our consultations always involve what would you most like to improve or correct about your skin. So what's your number one concern? And it might not be what you can see, but it's what they perceive to be their biggest issue. And if you have a discussion and you go a bit deeper and you find that there are actually 3 or 4 concerns. So the best way to address a patient's skin concerns is to say, we have a skincare management system. Marini makes a skincare management system. We have 4 different versions for various skin types. And we say this is a single solution. So you might be cleansing in the morning, putting a sunscreen on, then at night you cleanse again, and you might use an active serum, and then you use a moisturizer. So if you're diligent about your skincare routine, you're still using 5 products, right?
Right.
So when people sort of say, oh, I don't want to do all that, that's too much. It's not 5 products morning, 5 products evening. It's, 2 or 3 in the morning, 2 or 3 at night. But what you're doing is you're doing all the things that you need to do. So you're resurfacing the skin, you're providing antioxidant therapy, which is really important. Vitamin C is a great free radical extinguisher, and that's really important in the downregulation of inflammation. And you're improving the dermis by helping cell turnover, and you're moisturizing with some high-tech ingredients that will actually get into the skin and provide some hydration beneath the surface. And then you're protecting. So you might cleanse, moisturize and protect in the morning, cleanse and active treatment, active serums, and moisturize in the evening. So when you break it down like that and you explain it to people that they're going to get a much better result doing this single program, than they would if they just cherry pick from here and there. The
Mm.
other thing is that when you cherry pick, you're using different products from different brands. That is not going to get you the same effect, because each formulator understands the last product that they made, or
Mhm.
the other products that they're making. And
Jigsaw puzzle, isn't it?
yeah, you would be, more aware than anyone of this, Steph, that you make your serums and your moisturizers to go with your cleansers, or you make your cleansers so that it's compatible with your sun protectant. So you understand the regime, not just individual products. You're not just kind of plucking them out of thin air and making something entirely different and incompatible with the last product you made. You understand the bigger picture. And so once you explain that to a patient or a client, that these products are designed to be used together so they enhance each other's activity, and that, what we can't fit into one product because we've run out of percentage. There's, a product's only got 100% room, right? If 50% of that is water, you've only got 50% to add ingredients to, and some ingredients you need in higher concentrations. And then you've got to have all your stabilizers and preservatives, etc. So the layering effect is critical. I think a lot of people think of skincare as being like a shoe polish, something you put on, makes it look better for a few hours, and then you need to keep reapplying because life makes you, dusty and tired looking, right? So I think there's a real opportunity then to have a conversation with people about how they can get the best results out of their skincare.
I love how you call it a skincare system. You don't just pull it, they're not buying one product, they're buying a skincare system, and therefore you've packaged that up in the mind of the client as to be one thing. Because I think that's the hurdle. You're sitting there with a client, and in consultation, you're telling them, right, you need a multimodality treatment approach. We need to do some skin needling and low-level laser, and then we also need to incorporate some fractional RF, or because the skin needling is not going to get you there on your neck, skin laxity and all these things. And you try and explain the result, the actual results, the process, and then say, and on top of that, you need to buy these 6 products. It's a
Yes.
difficult premise. It's not easy. And I feel for the
So
therapist out
yeah, it's better to do it in reverse. So
there. It is, isn't it?
it's better to start with, okay, what do you want to achieve? So that's your end point, right? I want to get rid of these fine lines. I want my skin to glow, and I want to get rid of my pigment spots. So, okay, we've got all the tools at our disposal to help you get there. It's not going to be outrageously expensive, but it's going to cost you. You have to budget for this. So I think if you're upfront straight away about the financial ramifications of a full treatment management protocol, you gain the trust of the client that way. But what we always say is we're going to start by getting your skin health right.
I love that.
If we get your skin healthy, any treatments that we subsequently do, you're going to see a much better result from. You're going to heal much quicker. Your downtime will be shorter. You'll cope with the treatment better. There's all sorts of benefits to having healthy skin before you start any device modalities. They might be coming in for Botox or injectables, and you can iron out all the dynamic lines, but if they've still got passive lines and they've still got poor quality skin texture, they're going to be much happier patients if they spend that extra and look after their skin as well. So there's lots of ways to approach it, but we always start with, so we say there's a spectrum. There's, good skincare at the beginning, and there's facelift at the other end. So 70% of people don't want surgery. We've learned this over the years in plastic surgery practice. 70% of our patients would prefer a non-surgical option, no matter how well they could benefit from a facelift, correct? So a lot of people just don't want to go through that. The expense, the downtime, the fear of looking different, the risks associated, all that sort of thing. We see a lot of, pretty crummy facelifts walking around. So we know that there are a lot of people that are not prepared to take that risk. And, people just want healthy skin. They want to look in the mirror in the morning and say, wow, my skin looks really well. And once they put their products on and their makeup on, they're absolutely glowing. Consistently we hear this. my friends have been telling me how good I look, how well I look. And
I love that.
that can be with nothing else but just skincare.
It's such a
So we have,
morale booster, isn't it, as well?
it is a real morale booster. And I think it also speaks to that biological response we have. If someone looks healthy, it makes us happy, right? When
It
you're
does.
talking to
It's
someone,
chemically, it makes us happy, doesn't it?
yep, there's a biological, psychological component to that. If you're standing talking to someone who hasn't showered in a month and it's got missing teeth and stubble everywhere and they've been living on the street, your visceral response is just not too close, no matter how good-hearted you are. It's hard to get past that biological need to keep a distance. But
Mm.
if you see someone who's absolutely glowing with health, what do you want to do? You just want to admire them. You want to be close. You want to keep their attention because you're just reveling in how well they look. So that's a normal human response. And
But it
I
works
think
for us as well. If we look in the mirror, you've got a biological response. If we look healthy and well, our
yes,
brains understand that we are healthy and well, and then we become healthy and well. And that's why
exactly. Yes.
self-care is important, right?
Yes. So stress levels, cortisol, it's all interrelated. So yes, healthy skin is a huge first step to, mind body balance and just interacting with people, the feedback that you get, it just helps lift your spirits.
And doesn't it
So
mean that what we do is such a deeper meaning than just aesthetics? And you
much
talked about
way.
the
Yes.
separation in the beginning of our podcast, the separation between, having being a plastic surgeon and having your healthy patients and you're having your patients that are a little bit unwell. And there is such a deeper connection to what we
Yes.
do that really helps your longevity, your quality of life, and everything. And I would just want to say, Jan Marini is, in terms of quality, I mean, the fact that you know her and you got to meet her, that's a fangirl moment for me. I'd love to meet her.
Oh,
Um,
she's beautiful.
she's
Yeah.
incredible. She's so smart, and the things that like she's so ahead of her game, really,
Mm.
and she has been this whole time in terms of understanding skincare science, in terms of understanding formulation and what people need. I mean, doing it for that long, you acquire that knowledge, but it's just such a beautiful, not just that, it's a beautiful brand and it's such high quality. There are
Mm.
just those pinnacle brands that you look at, those heritage brands, and you're like, right, they've done it well and they've done it well for so many years. And you can trust, you can pick up a product and
Yeah.
this is going to work. And that's Jan Marie.
Mm.
That's one of those products that you pick it up and you're like,
Yeah.
wow,
Yeah.
I'm in awe. Yeah.
Yeah. And I think the thing that's extraordinary to us that it took us a while to understand is how things work in the States in terms of commercial and academic partnerships, which we don't really do here. So when we were making our own products in Melbourne, we worked with a scientist and we worked with the CSIRO, who we had a good relationship because we used to donate tissue, human tissue,
Right.
to them with patients' consent, obviously,
Mhm.
for all kinds of purposes. But there was never any discussion about a collaboration. There was never any, it's just not a concept to them. Whereas in the US, the public-private partnership is really exceptionally strong. So university medical research institutes will partner with industry,
Yes,
right?
yes.
In a flash, because it benefits both. So Jan has surrounded herself, she has probably one of the world's foremost formulation scientists, Subhash Saxena, Dr. Sachs, who worked with Albert Kligman. He was one of Albert
Wow.
Kligman's research scientists. He has developed more skincare technologies than anyone else.
That's insane.
He's head of R&D and has been for the last 14 years at Jan Marini. Jan started MD in the early 80s. So she's been at it for a long time. And that was the first professionally dispensed skincare line in the world.
Yeah, it
So,
was. Oh my gosh, I remember MD formulations. I remember the
mm,
first time I picked it up and I thought, oh, this is so different. This is incredible.
yes, yeah.
She's a definite
Yeah.
it's
And even though we can't say it, it was actually therapeutic, right? It brought about physical changes in the skin, just the resurfacing. There's a really interesting story about that Jan tells. The scientists that discovered glycolic acid. They didn't want to sell the royalties or the rights to the royalties to a particular major pharmaceutical company. So that pharmaceutical company spent the next 10 years bagging glycolic acid. So for a lot of years, there was a lot of negativity around glycolic acid. It thins the skin. It's so dangerous to use long term, blah, blah, blah. It's the second most researched ingredient in skincare history. Glycolic acid, retinol's the first, glycolic acid is the second. I am still reading papers. Last week I read an amazing paper that's just been published on how effective glycolic acid is as an antiseptic, it's been studied as an anti-inflammatory. There's so many benefits to it. It's an amazing ingredient.
Yeah, it's incredible. I honestly think that it is, for starters, you're right about the anti-information campaign. There is a lot of misleading information out there. I think all skincare ingredients, a lot of skincare ingredients out there, they all have their merits. If they're correctly and formulated with properly, you're going to get a good result if it is a good formulation. Honestly, I could talk to you all day forever. I love Jan Marini.
Thank you, darling.
So much for being an incredible supporter of the industry. Without you, without brands such as yourself and conscious people such as you, we would not have a voice to government. We would not have a voice for our industry, which we desperately, desperately need.
Yes, we do. And look, anything that we can do from a clinical perspective, we're more than happy to do. And thank you, Steph and ABIC, for flying the flag for the industry, because it's high time that government understood how much particularly women, this female workforce contributes for their families, their communities, the well-being of other women and increasingly men. To some extent, that might be one of the reasons it has been, the low profile has been maintained over such a long time. So
maybe
go you.
Well, thank you. Go us.
Thanks, Steph.
It is a collective effort. And thank you everyone for listening. Bye, Vivien.
Thanks. Bye.
You've reached the end of another episode of the ABIC podcast, your online support community for the aesthetic and beauty industry. Thank you for listening, and until next time, stay connected.